I'm Amanda Whittal, Research Coordinator for the Foundation for Alternative and Integrative Medicine. FAIM's goal is to share information about health options with the public through the expertise of over 100 guest writer medical practitioners, as well as international projects to learn and share options for health that are available worldwide. All information can be found on our website at www.faim.org. And as part of this work, we regularly interview practitioners from clinics and health centers that we feel the world should know about. We hope you enjoy today's interview. With Dr. Lindsay Adrian, a naturopath and fellow of the American Board of Naturopathic Oncology, who, besides her practice, has been a speaker for multiple international conferences and continuing education platforms. Dr. Adrian has a clinical focus on integrative oncology and complex conditions, both of which are areas in which inflammation and the immune system play key roles. Dr. Adrian, thank you so much for taking the time to speak with FAIM today, and welcome.
Thank you.
I'd like to start with just an open question to you for our audience. You take a very integrative and personalized approach to health, and it's quite inspiring. Could you start by just giving us a brief overview of how this looks in practice? What are some of the areas you specialize in?
Absolutely. Thank you. One of the things that is, I feel like a lot of people inherently understand, but is often missing in medicine is the fact that no two people with the same diagnosis have the exact same experience of the disease. And so what this means in my clinical practice is that when somebody comes in, yes, of course, the name of the disease or the disorder is important. There are some really important pathophysiologies that are unique to each kind of disease process. But the experience of that and the ways that I can support somebody and help them come back to health is going to be unique to each. So, for example, I have somebody come into my office and they've been diagnosed with chronic fatigue or fibromyalgia. That's an umbrella term for a set of symptoms. Now, my job is to get a sense for what's the timing, what makes it better, what makes it worse. I do a lot of testing for what are some of the underlying contributors to this. So, lots of functional testing as well as just regular labs. What does a person's blood sugar look like? What are their inflammatory levels? And then again, in those underlying contributors, are there certain infections? Are there certain toxins? There sort of gene pathways for elimination? Is this somebody who methylates really well? Or is this somebody that has a really hard time with breaking down fats and repairing things like our mucous membranes or our cellular membranes or any of these other structures? So that's part of what makes my intake process perhaps a little bit unique. Again, the name or the label matters, but it is not the only thing that matters. It's a starting point, by no means the end point.
Right. It's quite an interesting and complex area, I would say. And when you do these tests in the beginning, do you have a set few tests that you do from functional to lab work, or do you really tailor that right from the beginning when you speak to the person?
Absolutely. So it's all tailored.
Okay.
My intake process is 90 minutes long. And I've been in practice for 15 years and it's still 90 minutes long. In fact, I've had to sort of stop it from getting longer because it's always easy to just keep going. But a big part of that long intake is that I need to know a person's full history. I need to ask lots of questions about the way that they interact with the world and the way that they feel while they're walking through the world, as well as their health history. So it's not just when did you start to feel sick? It's also tell me about what healthy looks like for you or used to look like for you. Tell me about where you grew up. Tell me about what are some of the exposures that you've had through your life. Now walk me through each of those different symptoms you're experiencing and the nuances with each of them. Because then I can see, okay, I describe it like I'm building a web in the back of my brain. And I want to pull together, okay, well, these symptoms are all inflammatory symptoms, and these symptoms are all kind of immune dysregulation symptoms, or these symptoms are speaking more to a difficulty repairing cellular damage, or a difficulty with eliminating toxins. And while I'm making that web, I'm deciding, what do I want to test for? Is there particular functional tests? Are there certain gene pathways that I'm interested or concerned about? Or is there a picture of a nutrient deficiency that I want to check or verify? All of those questions go into making that web. And then that web goes into, what am I testing? Where are my treatment goals? All of those sorts of things.
Okay, I see. It's like a bit of a detective work.
It is. I feel like a little bit of a naturopathic Dr. House sometimes.
Yeah, I can imagine. Um, but it's incredible, and I think it's a very, very special and amazing approach, considering how unique each one of us is. And it almost feels like my next question is unfairly narrowing what you do, but I'm going to ask it anyway, because I know that your focus on one of your focus on complex conditions, there's a very key role of inflammation that plays into that. And I think it's a term that you hear more and more nowadays, but it would be great if you could just give some insight into what role does inflammation play in these complex conditions.
Well, I mean, I would say it's one of the pivotal roles. So, for me, and it's funny because you're asking the narrow question, and then I'm gonna bring it back out again. You know, which is what I do. So for me, it's not just, is there inflammation? It's where is the inflammation and what's creating the inflammation. So there's inflammation that's being directly caused by things like microbes and pathogens, and even toxins themselves that can cause direct inflammation in the cell. There's also indirect inflammation. And indirect inflammation, to me, is the inflammation from the immune system that's trying to do something about that infection, or do something about um, those autoantibodies, or what have you. And they're both have to be addressed in different ways, right? If you've got an infection, there are a lot of practitioners who just go after the bug. And it after is wrong, it's that it's only a very small piece of the problem. There's also, um, I think it's important to know that inflammation begets inflammation. So we have that direct inflammation from, say, an infection, and we have that indirect inflammation from the immune system trying to go after the infection. But then in the middle of both of those, you've also got damage, either from the immune system or from the infection. And that damage can beget its own inflammation now, because it's become its own entity. And so infections are a really great example of, you've got to kill the bug, you've got to fix the immune system, and you have to repair the damage. And if any of those three sort of legs of the stool is missing, the whole thing falls over.
Fascinating, a little bit disturbing, but fascinating. Um, okay. So inflammation on its own is a kind of limiting term, in the sense that it doesn't really break down the process. You've got to think about these three key components.
Yeah, yeah. The thing creating it, the immune response to it, and the damage that was done by it.
Okay. Okay. And I don't know if the sequence, do you generally go after what's causing it and then deal with the damage, or is it a very simultaneous process that you try to deal with all at once?
Yeah, I mean, it's very, very nuanced. It really depends on the person.
Okay.
So let me give you some context.
Okay.
I have recently had a young boy. He's 12, just come into my practice. He was bit by a tick just this past summer. Developed, a big inflammatory response about 1 week after being bitten by a bunch of bugs, which we realize now, at least one of which was a tick bite. Had a bunch of arthritis flare up, severe fatigue, some nausea, some flu-like symptoms. Then those all resolved. And 2 weeks later, mom brought him in to get assessed with me. The timing was perfect. With tick bites and tick-borne illness, our immune system creates antibodies in very specific timelines. So oftentimes with Lyme, people either test right after they were bitten and then they show negative because the body hasn't had the chance to make antibodies yet, or they
Mm.
test long after the tick bite, at which point the immune system is no longer making antibodies because there's this very specific window. So I'm very grateful. This mom brought this boy in exactly at that 3-week mark, which is perfect. So we do some tests. Sure enough, he's positive for Lyme disease and one of the co-infections. But now his immune system is calmed down. He's not got fevers. He's not got flu-like symptoms. The arthritis is gone. The fatigue is gone. Ostensibly, he's feeling like a pretty typical, 12-year-old boy. But mom's worried because mom has some friends who, had Lyme disease and then were fine and then developed lots of symptoms about a year or two later. And so she just wanted to make sure. So now this boy is out of the acute infectious phase. Okay. That big inflammatory burst from the infections themselves has calmed down. Then the big immune response that happened in the joints, which is not necessarily direct from the bug, that's the immune response. It can be a combination, but he had diffuse joint pain, which is less likely to be infectious and more likely to be immune mediated. That's also calmed down. So we're in this lovely, sort of honeymoon phase before the infection gets totally out of control. And while the immune system is in there trying to contain things, but actually doing a pretty good job of it. Now, I don't have too much cleanup to do. I don't have very much dampening of the immune system to do. The immune system is doing its job. All I need to go in is clean up anything the immune system can't handle. So I can just use antimicrobials and then some herbal supports for the immune system just to give it that little bit of support to help it along its way, because no antibiotic will ever kill the last bug, but the immune system can. And so in this case, I can just use antimicrobials and, like I said, some herbal immune supports. I don't have to do anything much more complicated than that because his body is actually really doing what it's supposed to. And I'm just there to make sure that there's nothing left behind. So that
Mm.
one's simple.
Okay.
Now, the opposite of that is when I have somebody come in and they've been unwell for a decade and they have seen 20 different practitioners before they've seen me. And then I do a whole bunch of tests and I find a whole bunch of stuff. And after 10, 20 years, it's not just one layer. By then, it's many, many, many layers. So the last thing I do in that case is go after the bugs. The bugs are deeply entrenched. And because, like I said, the immune system is the only thing that's going to get rid of the last bug, I actually have to work on the immune system first. So then my
Mm.
first layers are supporting, normalizing the immune system, especially if there's been any kind of autoimmune trigger in that. So I need to help those immune cells do their job more efficiently without as much friendly fire. But I also need to work on inflammation so that I can stop that larger damaging kind of cascade in the background. And I need to do some assessment for what else might be getting in the way. And so this is where the toxins are really important, especially things like mold toxins, where not only do they interfere with the immune system directly and they create a lot of inflammation, they also really interfere with the body's ability to kind of come back to homeostasis. It does this by messing with things like glutathione, and glutathione is absolutely essential for mitochondrial function, and they have direct mitochondrial damaging effect. And so, I have to make sure that a person isn't heavily burdened by all of these things, or it's going to be a heck of a lot harder to repair and get them back to normal. But the long and the short of it really comes down to when you've got this multi-layer kind of situation, supporting the immune system and working through the layers is actually considerably more important than the infections themselves. That's going to be kind of much, much later on in a person's treatment.
Okay. I see. I thank you for the examples because I think that really makes it very clear. And in this, you actually touched upon one thing that I wanted to ask a little bit further. We'll see if I narrow it down and you bring it back out. But you talked about the mitochondria, which I first heard you speak at the Congress for Naturopathic Medicine in July. And you were describing very nicely the impact, or the role, I should say, of mitochondria in inflammation and in our health. And I wonder if you could, in kind of straightforward terms, explain to us this very complex process. What role did the mitochondria play in all of this?
Okay. So mitochondria often get described as the powerhouse of the cell, right? I feel like that's the banner term that gets used for mitochondria. And that's true. However, it's an extreme oversimplification. So basically what it comes down to is that in every single one of our cells, with a few exceptions, but pretty much all of our cells, the mitochondria are kind of the brain. And they're kind of the brain because it's the mitochondria often that is sensing what the cell needs at any given time and then responding. And so, of course, the nucleus is what lots of people think of as the brain, and it contains all of our genetic material. And that genetic material is constantly being read and proteins and such being made. But oftentimes it's the mitochondria that is signaling what is needed at any given time. And so I think what's important for people to understand about mitochondria is that if they're not functioning very well, cells can get stuck because they can't sense what's going on in the environment and then they can't respond. And so, at a conference, I was speaking about something called the cell danger response, which is a model that was put forth by a researcher named Bob Navio, and he's brilliant and I love his papers. And so anyone that really is wanting to learn more about mitochondria, I encourage them to go and read Robert Navio's papers on the cell danger response. But the sort of heart of it is that the mitochondria have to sense when something is injuring us, right? So that's that very first job. And then it puts out a whole bunch of different cell signals and moves us into something called cell danger response 1, CDR1. And that's when the cell wants to make a whole bunch of inflammation because it's trying to kill that bacteria or that virus or that cancer cell. It's trying to respond by bringing a bunch of nutrients to the area, white blood cells to the area, a whole bunch of things that are meant to deal with the insult itself and keep us alive while we deal with that insult. Then when the conditions are right, that CDR1 has to transition to CDR2. And again, it does that by the mitochondria sensing what's needed in that environment and making a shift. And it's quite a significant shift. It's a pro-inflammatory situation over to an anti-inflammatory situation. And it goes from big oxidative stress over to cellular replacement. So things like recruiting fibroblasts and recruiting cells to come and repair the area that was damaged. So that's a repair phase. But if CDR1 gets stuck, we have a non-healing wound with a whole bunch of inflammation. If CDR2 gets stuck, we have too much laying down of cells. And that's like cancerous processes, or even think like sarcoidosis or granulomatoses, conditions where cells are just replicating.
Yeah.
And then again, the mitochondria has to sense when that's not needed anymore and shift into CDR3, which is when those new cells actually get reintegrated into the larger tissue. And if we don't have reintegration, that's when autoimmunity happens, because those new cells haven't had the sort of signals to tell the body that those new cells aren't foreign, the new cells are self. And so we need that reintegration step, which again is all dictated by the mitochondria. And then once that is finished and the mitochondria can say, okay, all of that new lung tissue, for example, that had to be made or repaired from that chest infection that you just had, that's been reintegrated into the whole. Now we can come back to resting homeostasis and just go back to normal cellular respiration and energy production and that powerhouse job. And so I guess the big important thing for people to know about mitochondria is that they're very, very dynamic organelles that are constantly sensing the environment, getting a sense for, in that individual cell, what do we need? Do we need inflammatory markers? Do we need oxidative bursts? Do we need to bring in growth factors and nutrients and things like stem cells? Or do we need to be repairing basement membranes, turning on or turning off major histocompatibility complexes, reintegrating new tissue into a whole? Or do we just come back to that good general cellular respiration state? And so the mitochondria are the absolute key. You cannot have good health without healthy mitochondria.
We should all know a little bit more about our mitochondria. So essentially, if they do get damaged, then our whole cell repair cycle won't function properly. It will get stuck or not started or something along the way.
Exactly, yeah.
And if it comes to inflammation or chronic, I guess maybe let me back up a little bit. How do the mitochondria get damaged in the first place? Is it a cause of inflammation, or is them getting damaged and disrupting this cycle more of the cause of inflammation? I guess which one comes first?
This is where I say yes.
I have a chicken and egg problem.
You do. So, we're very fortunate in that our body is always working toward health and well-being, right? I frequently tell people, my job is not to fix you. My job is to remove the obstacles to cure, right? My job is to help you get out of your body's way and take the other things that are getting in your body's way and pull them out, because your body will repair itself given the right supports. So, what that means for mitochondria and mitochondrial damage, unfortunately, pretty much anything that causes dis-ease can damage mitochondria. So, infections cause mitochondrial damage. It's actually one of the big things to come out of a lot of the research on COVID over the last couple of years. COVID is a significant damager of mitochondrial function. That's why the tissues that are most often symptomatic in COVID and in long COVID are the tissues that have high mitochondrial content. So the heart and the nerves, they are some of the richest in mitochondria. And of course, we've got a lot of cardiovascular symptoms and a lot of nerve symptoms, including fatigue, which is just neuroinflammation. So COVID, big mitochondrial damager. Pretty much all of our fat-soluble toxins, again, pesticides, herbicides, plastics, smog, mold toxins, all of these things have the capacity to disrupt mitochondrial membranes. And they're also just really, really inflammatory. And so they are directly injurious of mitochondria. But then on top of that, they also create these inflammatory cascades that can damage mitochondria just from the basis of being too much inflammation and too much oxidative stress. And so these little mitochondria, these little wonderful, amazing organelles, have the ability to sense that they have had too much damage, and they can actually go through something called mitophagy, which is the process by which they involute and self-destruct, because they know that they're too injured. But ironically, you actually have to have a good enough mitochondrial function for the mitochondria to be able to sense that they're damaged and then go through mitophagy. And so there's a whole, part of this whole anti-aging movement, or I like to say healthy aging movement, is to be able to help those mitochondria that have gotten old and damaged recognize that they are hurting us and encourage them to go through their mitophagy process. And there's lots of cool nutrients that are helping with that now. But anyhow, so when it comes to things that injure the mitochondria, just like inflammation, there's direct and there's indirect. And then the mitochondria will repair themselves or go through mitophagy given certain circumstances and the right nutrients.
Okay. Again, very complex, very interesting though. And that sounds like basically pretty much anything can cause damage to mitochondria if it doesn't make us feel rejuvenated or well.
Right.
So, you mentioned specific nutrients, for example. I'm just wondering, fortunately and unfortunately, many of us live in the industrialized world and we're exposed to lots of toxins, not always the healthiest food, high stress levels. If people want to keep their mitochondria healthy, I suppose it's probably different depending on if you want to proactively just maintain health or if you're in some kind of a chronic illness or just illness in general.
Mhm.
In both situations, are there, I guess healthy lifestyle is definitely one, but if you were to hone in on a few very important things for keeping the mitochondria healthy, can you share those with us, or is that too narrow?
Well, let me give you an analogy because I'm an analogy person. So when it comes to the health of the mitochondria, there are kind of four main things we want to think about. Okay. So for simplicity's sake, I have people imagine the mitochondria like a very busy factory. Okay. And so the very first part of the well being of a factory is that you have to get things to the factory that the factory is going to use to manufacture whatever it is it's going to manufacture. So I have people think about three different kinds of trucks that have to get to the factory. We have the carbohydrate trucks, we have the fat trucks, and we have the protein trucks. Each of those trucks uses a different type of fuel, but we need to get them to the factory in order for the factory to run efficiently. Carbohydrate trucks require alpha lipoic acid in sufficient amounts to get to the factory. Fat trucks require carnitine in sufficient amounts to get to the factory. And the amino acid trucks usually require a combination of alpha lipoic acid and carnitine. They're the blended fuel. And so I use functional testing to make sure that things like glycolysis is happening smoothly. And then the transition from pyruvate into acetyl-CoA, which is what actually moves into the mitochondrial membrane. And then beta oxidation, which is again the breakdown of fats into also acetyl-CoA and into the mitochondria. And then again, the protein breakdown pathways, amino acid breakdown pathways. So once all three trucks are getting efficiently to the factory, the first phase in the factory is called the citric acid cycle. And that people have to think about like big cogs on a wheel, right? And you're moving things through all of their intermediary transitions, and it has to move pretty smoothly. Now, the B vitamins are absolutely essential for this. And then certain key minerals, magnesium, manganese, iron, these are all really, really important. And so most people, if they're not getting a really good, a well-rounded diet, the simplest stuff that they could be taking to support overall health and well-being is a good B complex and a multi-mineral, because those B vitamins and those minerals are required not just for the cogs in the machine, they're literally required for 90% of the cellular processes in our body. They are absolutely essential. And we should be getting what we need from our food, but there are many different situations in which either the body needs more than you can take in, or you're not absorbing what you're taking in, or again, this multitude of reasons. So a good B complex that's got lots of B2 and B3, which are some of the main cofactors, right? B2 becomes FAD, B3 becomes NAD. These are absolutely essential. So cogs in the machine. Then we've got the electron transport chain, right? The electron transport chain takes one of the intermediaries from the citric acid cycle. And I tell people, think about it like a big conveyor belt. And as you're going along the conveyor belt, You've got people or machines or whatever that is, putting in their own little alterations along that conveyor belt, and you're getting energy, which is the main output of the factory. That conveyor belt requires CoQ10. It requires, again, FAD and NAD in good high amounts, so B2 and B3. But we're also needing a lot of antioxidant support while you go along that conveyor belt. Otherwise, things get jammed up. And if you imagine that conveyor belt as only being able to move forward as quickly as the person or the robot can make their alterations, well, if you've got a faulty robot, if your CoQ10 robot's not working so hot, you need more CoQ10, or it's just going to back the whole thing up, and you're still not going to make energy very efficiently. So that's where we get antioxidants. CoQ10 is really key. And then the fourth consideration is the fact that mitochondria make oxidative stress. It is an absolutely normal byproduct of a healthy sort of factory process, right? You can think about this as just the waste products. And so just like in any other factory, you have to continuously take out the trash and remove those wastes. And so in our cells, that's where all of our intracellular antioxidants come in. That's where things like alpha lipoic acid has a secondary role. It's an intracellular antioxidant, but that's superoxide is made, peroxide radicals are made, so we need glutathione. We need superoxide dismutase. We need all of those things that boost up our NRF2. And so that's a whole bunch of different nutrients. A lot of it is food derived. We make these antioxidants quite efficiently from good sources of brightly colored fruits and vegetables, from the broccoli family in particular, from sulfur donors, which is also broccoli family, but also things like garlic and onions, meats, again, lots of sulfur in our protein, in our animal protein. But we can also take these nutrients as a supplement, especially when our body is sort of overtaxed and isn't breaking things down and converting them overly efficiently.
Okay. Fantastic. Our mitochondria factory. I really like it. And I think it gives a really nice visual of this process that probably many of us just don't know the details of.
Mm-hmm.
I know we don't have loads of time, but I just maybe just to summarize it a little bit, our mitochondria are super important. They are at risk of being damaged. Not everyone will know where to get some of these nutrients you mentioned, but it sounds like most of them would be best derived from food. Is that a fair statement?
It's ideal. Now, again, it all depends on the wellness of the person, right? If you've got somebody who's overall quite healthy, they're going to be able to get what they need from food, and they can make good food decisions to be able to boost up some of the nutrients that they require. If I've got a patient who is barely hanging on by their fingernails, first of all, they need so much more nutrients than they can consume. And second of all, asking them to make, really nutrient dense, good quality food decisions is sometimes a little bit unrealistic as well. So this is where, I will use high dose supplements, some gentle, safe for pretty much everybody ones that I suggest consistently. Like I said, is a good quality B complex, a good quality multi-mineral that's got a lot of those trace minerals, not just the big ones like calcium and magnesium. And then something like N-acetylcysteine, which is a really inexpensive, very bioavailable, good source of cysteine, which unlocks a lot of our different needs in our body, right? It acts as an acetyl donor, it acts as a sulfur donor. It's cysteine in and of itself, which is one of the byproducts of the sulfation cycle. Lots and lots of different things. I could talk for hours on what N-acetylcysteine does, but it's a really bang for your buck, phenomenal support that will be really helpful for lots of people. So those are some of the easy supplements. But then again, it's everything else is really tailored to the person and is going to be unique for each situation.
Completely understand. But I think it's helpful, especially for listeners who maybe just want to, not necessarily facing a health problem, but want to maintain their health. And I suppose just having that better understanding is really helpful if somebody does have to go see a professional if they are facing a health issue.
Mhm.
Is there, just in our last few minutes, is there anything else that you think is helpful for people who want to maintain health or improve their health? Anything that you haven't said about the mitochondria, the way inflammation works in our body, that is a very key thing for people to walk away from? Or do you think we've covered it all?
One of the things I always want to come back to is just how incredibly smart our bodies are, and that sometimes we have to just listen. So remember that every symptom is a communication. That's all. The body isn't being mean or purposefully injurious. It's trying to communicate something with us. And so if we have inflammation, it's not good enough to just squash the inflammation. We need to know why we have inflammation. We need to listen to what the body is communicating before we quench the way that it is communicating. And so the best way to resolve inflammation is to figure out why it's there, and then your body doesn't need to send that signal anymore. So please, if you're not feeling well, don't just go looking to feel better. Figure out why you're not feeling well, which is really about, probably working with a practitioner that's going to do some functional testing. And it's not good enough to just take a pill and feel better if you have to take that pill every day in order to feel better. And that's the same whether it's a conventional Western medicine or whether it's a natural medicine. We need to know the why so you can fix the issue so that you don't need that anymore.
Absolutely crucial, and speaks to the power of our bodies to actually heal when we give them a chance.
Mhm.
Dr. Adrian, thank you so much for giving us a little bit more insight into this phenomenal process within our body. And I think just giving our audience a little bit more to think about in terms of supporting ourselves to live a good quality, healthy life. Um, I wonder if there's any information, if the audience wants to ask you more questions or get in touch, perhaps we can share your website if that's all right, at the end of the video.
Sounds good. So, my main sort of educational platform right at the moment is actually Instagram. So people can follow me on Instagram at Dr. Lindsay Adrian. And that's just DrLindsayAdrian. It's just my name, no dots, no spaces, no periods. My website is coming. It will be an educational website really geared toward education. And it's just going to be www.drlindsayadrian.com. Very simple. But that will all launch on Instagram. So that's probably the best way for people to follow me from an educational perspective. Clinical inquiries and questions all should go through my clinical office. I work at a clinic here in British Columbia, Canada, just sort of as part of the Vancouver area. It's called Port Moody Health, and the website is just www.portmoodyhealth.com, and that's where people can direct questions of that nature.
Fantastic. Then wish you all the best with your continued practice and education platforms. And thank you so much again for your time.
Absolutely. Thank you so much for having me.
Of course.